Hi, everyone. Thank you so much for joining our webinar this afternoon. We'll give it another minute or two. I can see everyone filing in here, so we'll give it another minute or two. All right, we'll go ahead and get started. Thank you everyone for joining today for our webinar. What is a water management plan and why do I need one? Before we get started, just a couple housekeeping items. The webinar will run about 35 to 40 minutes with a Q&A at the end. As you have questions that come up during the webinar, go ahead and send them in the Q&A chat at the bottom, and then we'll get to them at the end. If we, for whatever reason, run out of time and we don't have enough time to answer all the questions, we'll make sure to reach out to you. We'll also be sending out a link to the slides and a recording to this webinar as well after this is done. So with that, I'm going to pass it over to our speaker today, Brian Waymeyer, who is our CEO of IWC Innovations. Brian?
Thanks, Rachel. Greatly appreciate it. Thank you, everybody, for taking time on this Monday to come learn about this mystical thing called a water management plan. It is our goal today is, we'll cover actually, Rachel, if you want to go to the next slide, since you're running all this for me today. I'm not very good with technology. Rachel's the one who does all this for us. But what we're going to cover today is why a water management plan is important, what it actually is, who really needs one, key components of a plan. In other words, what I mean by that is, what do you really have to do to be compliant and actually to protect yourself from a risk point? And also if you have, immunocompromised people or staff, residents, employees in your facility, consequences of not having one. And we, here at IWC, we never want to, scare anybody or lead with fear, but there's some things that are really can happen. And we're actually involved with them almost every single week. That we just want to kind of point out and make sure that everybody is in the know. And the last piece of this will be how to get started. This is, obviously this is an IWC led webinar, but the goal is more education today. And, at the end of it, we'll have to Q&A, and obviously, any of your questions, anything that we can help you with, we're happy to do. Okay, next one, Rach. So why is this topic important? So the next slides, 4, 5, 6, 7, and 8 are going to show you something. And this is actually CDC data. And then the data actually shows what have we, reported cases by state. But what I mean by reported cases is Legionella. So I'm going to step back just a little bit and give you kind of just a tad bit of history so these slides make sense. So the CDC started reporting cases of what's called Legionellosis in 2007. This is the first one, and they post them, I think, every 5 years as they went forward. And you're going to see a trend. And the reason this trend is so important, and as we'll talk about this, is one, there's now a U.S. standard. It's called ASHRAE 188, and we'll talk about that as we go through this. There's also a heightened risk of pneumonia. In other words, if someone is to go to a hospital and they're diagnosed with pneumonia, they also now, the infectious disease specialists are actually testing them for Legionnaire's disease at the exact same time. So you're going to see a really alarming trend. So Rachel, what I really like to do on slides 4, 5, 6, 7, and 8 is really kind of show that trend as we go forward. So we'll go 5 slides forward, and then she's going to go back and we're going to show it twice. Is that okay, Rach? All right, let's do it. So that's 2012, 2017, 2018, and then 23. I think it's the last reportable year, right, Rach? Yeah. So you can see all of the reported cases of Legionnaire's disease in these states. And I like to attribute this to one thing, and we can go to the next slide, Rachel. I would like to attribute this to one thing: is ASHRAE 188 is important, but also we have a huge aging infrastructure in this country. And what I mean by, if you look back, let's go back one more, Rach, you'll see all of it's a lot concentrated over in the Northeast, which is our oldest part of the country. So that's why we're seeing heightened One awareness and more cases in those places is, and it's the truth. And I'll show you some pretty alarming pictures as we go through this later in the slide deck. And everybody's never going to want to drink water again after you see this. But it's alarming, but it's also great that we actually have this in place. Okay, let's keep going, Rach. So not only do we have the CDC, which is the slides that you just saw before, not only do we have the heightened risk exposure, but the heightened surveillance of Legionnaire's disease, but now we have more regulatory scrutiny coming into play. What this means is if you have a facility that has immunocompromised people or that fall under the ASHRAE 188 standard, which was published in 2015, it's very important that it needs to be followed. But the state started getting involved with this. So this is outside of CMS. So these certain states that you see either have legislation in accordance with ASHRAE 188. In other words, they might want you to test your cooling towers. They might want to have Legionella testing on a quarterly basis for nursing homes or hospitals or healthcare facilities. Virginia is the first one that actually passed the law specifically for schools and secondary education, which is very important. Sorry, I'm going to take a quick drink here. But what that's telling us here at IWC is, one, we're in the right business. Everybody should laugh at that one. But number two, also that scrutiny is there. The states are now jumping on board. We anticipate within the next probably 5 to 10 years, this map that you see can be completely covered with the state saying, hey, you have to do something in accordance with the ASHRAE 188 standard. Okay, so this is what I didn't want to show you, but I do want to show you because it makes a lot of sense. So remember, I showed you those slides, and then we talked about the scrutiny, we talked about the aging infrastructure, and we talked about why is this happening. One, remember, they're actually now testing for it within, if you have pneumonia, and if your patient has pneumonia, but also look at this. That is inside of a water main. Okay. That is I think it's probably a 20-inch, maybe a 24-inch water main that moves water throughout, the infrastructure and for your facilities or your homes or any of that stuff. And you can see the pipe hasn't really eaten itself. What has happened is that's biofilm. And we're going to talk a lot about biofilm as we move forward, but all that is just, it literally contains a tremendous amount of bacteria. And I could talk about biofilm for the next 20, 30 minutes and everybody would fall asleep and eat their lunch and so on and so forth. So I'm not going to do that. But I want everybody to remember this picture because it's important as we move forward. Okay, Rachel. All right, so we talked about aging infrastructure. We've talked about, why this is such a big deal, but now let's really talk about risk to you, to the end user, to the operator. Lawsuits are becoming a bigger piece of all of this. And the reason why it's becoming a bigger piece is, one, remember, it's reportable. There's more cases of it. They're seeing a lot more of it, but then there is a standard that exists. And what I mean by that is that there is a standard that is out there to reduce your risk or reduce the risk of your employees, staff, as I said before, getting this disease. And then I'm going to say this one thing that's very important. The CDC states if you do 100% everything correct, there's still a 10% chance that you can get this. So not only is it a really good thing to do for your employees, your staff, your residents, whatever type of facility that you are in, but it's also a great idea to reduce your overall risk. And what I mean by that is no one wants to be in the news. No one wants to be on the other side of a lawsuit. And we deal with them a lot. Rachel, I know she probably gets warnings and alerts every single day, but here at IWC, we always deal with them. They call us, after the fact. Hey, we didn't have a water management plan in place. What do we do? And I just kind of always bow my head and say, well, this is what's going to happen. Okay. So complex building systems. So a water management plan is really designed to manage the water in a complex building water system. So I'm talking, central hot water systems, buildings had been added on to, with booster pumps or, aerators or hammer arresters, all of those things. And what I mean by complex is it's not like your house. Okay. Your house, you have one water entry, might be 3/4 of an inch. It comes in, it feeds your showers, it feeds the kitchen, it feeds all of those things. Very simple. These systems can have like cooling towers and boilers, which boilers aren't at risk, but we'll talk about that later. But hot water, central hot water systems, multiple hot water heaters, multiple wings and all those things. That's what a complex building water system is. That's what we're really trying to manage in this situation. Okay, Rachel. All right. Now we get in the biofilm thing, right, Rachel? I think we'll be good on this. Let's make sure I got my slides going forward so I know where I'm at here. Okay. Biofilm. If you looked back before, remember I showed you that picture of that pipe, and this is a really good analogy. Biofilm. Okay. Biofilm is, think about, these water, that pipe that you saw. It's all of the bacteria that grows and creates its own existence. And what I mean, its own like community of other bacteria in these things. And it's all based on what's called EPS. Okay. And EPS is what I call scaffolding. Okay. And it's, in other words, it builds on itself. All right. And as that scaffolding builds up, everything under that scaffolding just kind of protects all of that biofilm. Let's go next, Rachel. And then you can see these biofilms. Okay. It attaches to the surface, grows, it matures, and then it disperses. Okay. So what I mean by disperses, it gets to like what I call past homeostasis. In other words, everything's happy, everything's in a great place. And then it says, you know what? I have no more room for this. So what it does is it sheds off that top layer, and then that layer moves on to the next place into your facility and grows and proliferates. Let's go next. So what can grow in your Legionella water system? So I think this is kind of funny. I think they should put all this stuff in a kid's spelling bee. And the reason I say that, because they'd be like, what? And you'll see what I'm talking about. It's not just Legionella anymore. It's waterborne pathogens in general that we're trying to prevent. Okay. So there's Legionella. That's the one that everybody knows about. That's the one that, came out in 1976 at the Bellevue Stratford Hotel in Philadelphia. It was cooling towers. It sickened many, many people. Center for Disease Control literally tagged it back to the cooling tower in that facility. And there's a little caveat on that, but back to that cooling tower in that facility. That's why everybody always thinks these are cooling tower diseases. And that's how Legionella was born. It was actually at the Legionnaires' Conference, henceforth why it's called Legionella. But that's the one that we worry the most about. But that's not the nastiest of them all. Let's go to the next. See, Pseudomonas. This literally should be in a spelling bee. Pseudomonas, and then I'm not going to dive into all these. It's just another bacteria that's waterborne. Let's go to the next one. This is my absolute favorite non-tuberculosis myobacteria. And do we have any more? Next. Okay, so we don't, but those are kind of the three biggest ones, and they're within your facility. Now, where risk exists in your facility. All right, Rachel, let's go to the next. I talked about cooling towers. Remember, I just mentioned that here a second ago. Legionella loves to grow in between 77 and 122 degrees. Okay. It is a aerosolized type bacteria. In other words, you have to breathe it in, has to get into your lungs to cause disease. Okay. And it loves to grow and proliferate. And it actually can multiply. Legionella can multiply every 4 hours. So it's a pretty nasty, fast growing bacteria. So what we try to do is we try to control that, one with the water management plan, also with the water treatment program and cooling towers. But something that's very important to realize, cooling towers are not the biggest reason for Legionella. It's actually building water systems. Remember those complex building water systems I touched by it a little bit earlier? That is really where the risk is, because they're in the facility. Cooling towers, yes, they're on top of your building, but they're out. But 76% of all cases are attributed to potable water systems inside of your facility. Let's go next. Hot water tanks are risk when they have temperatures and bacterial growth range. We just talked about that. Sediment buildup. I know everybody on this call that is an operator of a facility knows about your water heaters. They get clogged up. That is actually a really good place for biofilm to grow. And then when you turn them off to clean them, that biofilm gets sloughed off and it goes into your facility. Let's go to the next. Dead legs. So think about this, and we're going to talk a little bit more about a water management plan and dive into it as we get a little bit deeper into this. Hope everybody's still awake. I'm trying to, keep this going here. But dead legs. Dead legs is, think about a building that's been added onto, and a plumber capped off a 20-foot section of pipe, and that water just sits there and sits there, and it just grows and grows and grows and grows. That is what a dead leg is. So it no longer moves water. It's at the ideal temperature. Sitting thinking at a facility at, everybody keeps their buildings like at 72, and the summer might be around 77, and it just grows that biofilm and it allows bacteria to multiply. Let's go to the next. Decorative fountains. Who would have ever thought that beautiful fountain out in front of your facility could be a risk? So decorative fountains are a big risk because look, it's aerosolizing water at all times. And you're walking by and saying, oh, that mist feels really good. But then you're breathing in Legionella. Rachel, everybody's going to run and turn off their fountains today after this. I feel really bad. But those need to be controlled. And that's what a water management is designed to do. And I can dive in a little bit more, or I can answer questions at the end, but that is a big risk. Let's keep going. Showers and sinks. Pretty much every one of your sinks are going to have aerators on them. And aerators are designed to aerate water, so you have that nice stream. And what I mean by that nice stream, when you turn your sink on, it doesn't spray everywhere. So it keeps, people from slipping on water, all those things. But aerators aerate water. So when you wash your face and all that stuff and you get down close to that sink, that can be an aerosolization. So we have to control for that. The next one is showers. Same thing. Showers, water sprays out, it aerosolizes, and you take your shower. It's nice and steamy. You breathe all that in. Let's go. Keep going. Ice machines. Who would ever thought ice is a problem? Not me, but it actually is, especially in the healthcare settings. The reason why is because people that have COPD or problems with respiration or problems with breathing, or they lay down when they, here's your ice chips, right, in your hospital. Not a good idea, because they can aspirate, swallow them, and that ice can actually contain Legionella or other types of forms of bacteria. So it's a big risk. And I've been doing this a very long time. Most of the ice machines that we test, and I'm going to scare everybody, I would say probably 30 to 40% of them usually have Legionella bacteria in them. Next. Okay. I guess this is what we're supposed to be talking about today, right, Rachel?
Yes.
All right. So we'll get into the real crux of the problem here. As I said before, and I kind of give you a little bit of background leading up to all of this. What is a water management plan really? What is it? Let's go to the next slide. Water management plan is a document, okay? And I like to say this, it's a living document. And this living document is designed to reduce risk. So we just talked about fountains. We just talked about cooling towers. We just talked about plumbing systems. We talked about showers and aerators, because everybody on this call is probably sitting there thinking, well, great, he's telling me all these things that can kill us. Sorry, I'm not trying to be a Debbie Downer. I'm really not. Or cause risk, but what do we do about it, right? This is what a water management plan is. It is literally designed to reduce those risks. And we're going to talk a little bit more, let's go to the next one, and dive into kind of like, I always like the eye wash station, and we'll talk about that as we go through that, but to really give you an example of why it's important. So it's important. A system, it identifies, monitors. We talked about all those things that it monitors, and it protects occupants, ensures regulatory compliance. But it also really, it's designed, yes, for safety. It's designed all that, but its really main purpose is to reduce risk of the overall facility, not only for the owner and operator on a financial side, but the people on the side of that live, operate, or work in that building. Let's go next one. Rachel, this is a good one. I like this one. So what a plan isn't. It's not a binder that sits on a shelf and collects dust. And Rachel runs marketing here at IWC, but I think we always shake our head and laugh, because we'll walk into a facility or we'll get a new client and they're like, oh yeah, we have a water management plan. And that binder's been sitting there and it's got like an inch of dust on top of it. Remember what I said, it's a living document. The standard is still a living standard. It changes all the time. There's a lot of stuff that goes into this. So it's not a compliance checkbox. It's not only needed when something happens. In other words, you have an outbreak or confirmed case. It's solely the responsibility of the facility team. It's not. It's a whole holistic look at the building and how you manage water. It's not just temperature logs. It's not just chlorine logs. It's It's not a generic template. It's not a document that can be created once and never been updated. And the last piece of this, it's best practice in high risk facilities. I think I've kind of labeled some of those: complex building water systems, immunocompromised people that stay overnight for 24 hours, buildings with fountains, cooling towers, so on and forth, so forth. That are high risk facilities. Okay, Rachel. Who needs a water management plan? Well, remember at the very beginning of this, we should kind of show the states that have individual legislation involving water management. But here's the thing. This all started in 2016-ish, 2017, when CMS, Center for Medicare and Medicaid Services, came out and said, 2017. See, Rachel, this is why you're always better than me. June of 2017. Hospitals, nursing homes, long-term care facilities. The actual document said, the memorandum said, critical access hospitals or skilled nursing facilities need or must implement a water management plan in accordance with ASHRAE 188 to reduce the risk of waterborne pathogens in the facility. And remember, ASHRAE 188 is the controlling document. There's now ASHRAE 514 that I did sit on the board, and our VP of technical, actually Jeff Rogers, sits on the board of ASHRAE 514. 188 was more Legionella focused. It was really hard on that one bacteria, that one waterborne pathogen. 514 kind of jumps into more specific requirements and gets really into other waterborne pathogens. So yeah, CMS, if you are a medical facility and you take Medicare and Medicaid money, then you get a survey, this is required. This is required something that you have to do. Talked about ASHRAE 188, and then additional, like for instance, New York, they have local law 77, which mirrors ASHRAE 188. They talk about cooling tower. They just came out with a new law that you have to, instead of testing the tower quarterly, I think it's now monthly, right, Rachel?
Yep.
GSA came out with a drinking water testing guideline. I told you about ASHRAE 514. OSHA now has issues, or has issued some guidance on this. And then there's the VHA Directive 1061, which covers all the veterans' homes and veteran homes administrations and all that. All right, let's keep going, Rachel. I don't want to run out of time here. Okay. What happens without a water management plan? Okay. If you're Medicare, Medicaid services, and you have those surveys, you can get regulatory citations. We have seen on many occasions if they don't have a water management plan in place, or this is a very important one, you do have a water management plan in place, but you didn't do anything about it. Remember, we talked about letting it just sit sitting on that table or that binder, and no one ever looks at it. No one ever has the required meetings. The team's like, huh, what's water? Or, the one that I love the most is that the COO of a large nursing care facility said, I'm on this team. I didn't even know that. So these are the things that you don't want. The reason why is because you can get citations. If you're in the healthcare world, it's called an F888 tag, which can actually lead down to an immediate jeopardy or an IJ, and they can shut you down to admissions very easily because we have seen it happen. Lawsuits, insurance claims. And I caution everybody, this is a really good thing to check with. Check with your insurance companies, because we deal with this, like I said, a lot. And Legionella sometimes is covered by your insurance. You would never even know that, but it is. And it can be very expensive if you have an outbreak and have to clean your facility or remediate your facility. Reputation damage. No one wants to be in the news, especially in the healthcare world, especially in the hospitality world. No one wants to be in the news. And then, like I said, those emergency remediation costs. Let's keep going, Rachel. Core components of water management plan. And the one I'm really going to talk about most is the documentation side, but let's go through these, Rachel. This is good. And I wanted to make sure we talked about this one as we went through this. And I was kind of racking my brain, and Rachel does such a great job of putting these things together for us. But I really wanted to make sure that I talked about this. It's like, what are we actually trying to control? We've talked about the biofilm. We've talked about the bacteria. We've talked about, aging infrastructure, all that stuff. But what are we really trying to solve for? Well, ASHRAE 188 and those documents for water management are solving for this. This comes straight out of the CDC. Sediment and biofilm. And by the way, all four of these, we call it the STAR acronym, all four of these are interrelated. In other words, you want to control all four, because if you use control one, the other three will get out of control and that'll cause you issues. So remember, all four of these are interrelated. So sediment and biofilm. You saw that picture of that pipe. This is why this is visuals. I think so. I always say pictures are worth 1,000 words, right? That biofilm in that pipe, okay, that sediment, all of those things that they work into that EPS, and that structure and that scaffolding to build those biofilms. So sediment's a big problem. So you want to keep sediment out of your facility. And that could be sand, it can be calcium. There's all kinds of things. Okay. The next one's temperature. Remember, I told you Legionella loves 77 to 122 degrees. We want to control temperature. We would love to keep your water out of those ranges. So what we really want to do is keep hot water hot, keep cold water cold. And then next, the age of water. This is very important. And what I mean by water age, in other words, if you have a gallon of water that comes into your facility, how long does that water take to get out of the facility? So in other words, if you make up 1,000 gallons in a day, or you use 20,000 gallons a day, okay, but your sewer bill is 19,000 gallons for that day. Or excuse me, 15, but it's going to be much lower because some stuff, if you have a cooling tower anyways, I'm not going to get too much into it, but that's really what we're looking for. How long is that water sitting in that facility? And the reason why, the longer it sits, the more proliferation of waterborne pathogens. Remember, I told you Legionella grows or quadruple or doubles in size every I think it's 4 hours. Yeah, I believe it's 4 hours. Don't quote me on that. Rachel can probably answer that question later. All right. And then we have residual disinfectant. In other words, how much chlorine do you have coming into your facility? That makes sense. It could be monochloramine, it could be chlorine, it could be chlorine dioxide, whatever the municipal water is using. So those 1976, yes, it has not been changed from 76. I think that might be the day. Has not been changed. The Safe Water Drinking Act in the United States says that it has to deliver. Some states have a little bit leniency on this. 0.5 free available chlorine, if that's what they're using, to the end user. In other words, who's last on that line? And if you know anything about chlorine, you know anything about disinfectant, I bet you if you're at the end of the line, you're not going to be getting that, but you're supposed to. All right, Rachel. So established water management team. So I told you about the COO that we had one of these, the water management plan, and he didn't even know he was on the team. So it's very important that when you have a team, in other words, the team should, if you're healthcare, you want infectious disease to buy in. You might want your chief clinical officer. You might want your head of facilities or your housekeeping team all involved in this. Even maybe a consultant that really knows, what's risks to these things. That's very important because you have to have these people buy in and then drive the direction of the plan that you build. Okay, Rachel. Then describe your water systems. It actually is easier said than done. I know everybody always like, oh, we're going to map your whole water systems. Well, yes and no. But what we're trying to do is we're trying to identify within your facility really the big risk factors. Let's go to the next part of this. So what I mean by risk factors is do you have a cooling tower? Do you have those fountains? Do you have eye wash stations? Do you have aerators? All of those things in the facility that we're really trying to, yes, kind of map out, but really to identify. And then, the hazard analysis, you can do that yourself, or you can have a consultant do it. Same thing, identify where conditions support growth. Let's go to the next one, Rachel. Control measures. These are the most important part. This is where the rubber meets the road, or where your consultant or a engineer or somebody comes in very handy. And I'm going to use this. I'm going to use the eye wash station that I like to use so much here. So control measures. Make sure where I'm at. Okay. So think of an eye wash station, and that eye wash station is sitting in your facility and no one's touched it for years. Okay. Just sit there. It's growing dust. You got to peel the little, the eye wash things. You got to peel those things off of there, and it just sits there. So it's been sitting there in the summer and the winter, and it just grows bacteria. Why that's important is you want to move that water. Remember those 4 things I talked about? So all that sediment's in there, all that biofilm is in there. Hasn't touched chlorine in years because it just hasn't had any new water run through there. And water age, talk about really not good. So I always use this one because it resonates with everybody. If you move water, then you're starting to solve all 4 of those things within there. You're starting to move the water. You're going to get chlorine in there. The age is going to go down. Sediment, we're going to start moving that out through the system, and residual disinfectant. All those things we're just trying to get out. But the eye wash station is important because it really does grow a lot of bacteria. Most of them that we test, if they're not flushed weekly or every 2 days, which is your control measure. And what I mean by that is you write into your plan, says, hey, I have 4 eye wash stations. They need to be flushed, 3 to 5 minutes, 3 times a week. That's what a control measure is. Let's go to the next. Monitoring documentation. This is, I always laugh at this one. And I think everybody on this call knows if you run a facility or you're in healthcare or hospitality, if you didn't document it, it never happened. And I know a lot of lawyers that say, prove it. That's what they always say. Well, prove it. Did you do this? Well, we have a water management plan. Well, did you do it as written? Prove it. That's all. That's what the first thing they always ask us. So documentation is very key in this. I don't care if you use software, you have a pen and paper within your water management plan and say, hey, I did my 3 to 5 minutes for that eye wash station this week. Next one. Corrective actions. Well, this is, so you have your control measure. Then you have the documentation piece, and then you have the corrective actions. In other words, what happens if I didn't flush it for 3 to 5 this week? What are you going to do to get back into compliance? Next. Verification and validation. Once again, it can be testing. It can be annual. You have to annual review. It's actually written in the document that you want to review your water management plan on a yearly basis. Did you add on to the facility? Did you change out some sinks? Has your cooling tower been cleaned? All of those things need to be reviewed every single year. And next. Oh, and remember, it's a living document. So ASHRAE standard itself changes. So you have to make sure that you're up with the most current. Common misconceptions. We never had a case. Well, that might be true. But I mean, if it was me and I own facilities, I would rather have this in place. So then when we do have that case, and the very beginning of this, the CDC flat out said, and I told everybody, you can do things 100% correct and still have a 10% chance of getting this. I would rather have a really good water management plan on my side, because that should get out of jail free card. It truly is. But it's got to be compliant, which is what we've talked about, all those steps, and it's got to be accurate, and it's got to be documented. City water handles this. Well, remember I told you, city water, I wish it did, but they're supposed to deliver that 0.5 free available chlorine at the farthest distant way. And that chlorine gets used on biofilms from the municipal water plant all the way to the end of that line. So think about it. I bet you're probably not getting the 0.5 if you're very far back on that line. Our water treatment vendor covers this. Do they? They might do it on the water, on the cooling tower, but I don't think they probably do the rest of it unless they're getting paid for it. That's just my 2 cents on that one. And last, it's just paperwork. It isn't until it's not. And you don't want to be on the part where it says it's not. Okay, Rachel. What does a good plan look like? This is kind of getting a little bit repetitive, but living document, regularly reviewed, clear ownership of it, data-driven decisions integrated into operations. There's a lot of good softwares out there today. Obviously, IWC has one. A lot of the competitors have one. But what we want to do is we want to take all of the stuff that we're doing for this water management plan. And if you're testing, great. You don't always have to test. Depends on the state. What is your pH readings? What is your free available chlorine readings? And then act on that data. And I love, Rachel, that you put in there data-driven decisions. In other words, you can do something. You can always do something because, as my grandfather always said, well, that's because we always did it that way. Okay. I don't like to believe that, because you got to take what you've done and improve on it on a year-to-year basis. And that's what a really good water management plan is designed and supposed to be doing. Key takeaways. Rachel, I'm doing pretty good. 6 minutes left.
Yeah, you are. Nice job. Go on.
Okay. Key takeaways. Water management plans reduce risk. That they do. And I've talked about it. I've talked about what the CDC says. I've talked about what lawyers have said. It truly does reduce risk. It does. And many facilities need them. Some are required. We've already talked about the regulatory side of this. And that's that picture of the states and all the states that are going to be adopting this. I've talked about CMS, for Medicare and Medicaid services, and why it's very important. And then they protect health, finances, reputation. It sure does. I mean, I always want to be on the side of, when a customer calls me and says, hey, we have a confirmed case. By the way, we get about 2 or 3 of them in each week here at IWC. I always want to be on the side of, hey, have you been doing your water management plan? Do you have documentation? And if they say their answer is one, it's usually what's a water management plan, or two, they say yes, and it's in through your system or whoever system is, and here's the documentation. That immediately gets rid of the risk side or the negligence play. And then we can just go on and fixing the problem as is. And then implementation is structured and manageable. What it means is this doesn't have to be difficult. I know I've said a lot of things today, but it truly does not have to be difficult. It has to be smart and logical, is what I always say. In other words, you know, the team is there for a reason. The facility people there for a reason. Everybody's supposed to bring their expertise into the system and say, hey, okay, we have 8 rooms that are being remodeled. Maybe we just block those off as close to the main as we possibly can while those are being remodeled. Then we turn them back on. Okay, we'll make sure we just move the water and make sure we get some chlorine readings in there. It's just common sense things like that. Clean your water heater. That's very important because it does 2 things. One, your water heater is going to last longer. And 2, it gets rid of all that sediment and biofilm and all that nasty stuff that's in the bottom of the water heater. And if anybody's never looked at it, I highly suggest you do it. It's pretty gross. All right, what else? Next one. Getting started with us. Well, I've kind of told you kind of what we do, how we do it, why it's important. We have our own proprietary software. I'm just kind of educating you. There's other companies that do have the same thing. But the goal, if I can teach anybody today, it is a risk. It's easily managed. And it's what I would call very inexpensive insurance. And it's the best thing that you can do for your residents and the people in your facility. I think we are done.
Yeah, now we're to the Q&A.
Hey, Reeves, I didn't do too bad.
You did great, Brian. Let's see here. It looks like someone was having an audio issue. Hopefully, I did not see that. Hopefully that resolved itself. Will we have a copy of the slides or the recording? Yes, we will send out a copy of the slides and the recording after this. In New Jersey, there was a phased timeline for skilled facilities indicating when it would be mandatory to conduct yearly testing. Can you tell me when this is?
I think it was 6 months from the implementation of the legislation. And I don't remember exactly when that is, but Rachel and I can find it for you and get it to you. But I'm almost positive it was 6 months after the legislation passed.
Yeah, we will double check that and we will get back to you on it. Would you suggest a source to adapt a water management plan for a K through 12 facility? I'm interested to see a model plan.
Sure, we can kind of give you a model plan. We provide those. They're not I mean, it'll be 1 or 2 pages. Rachel, you can take care of that.
Sure. Yep. That's all we've got. Okay, here's another one. How is bleach added to the water system to remove biofilm from the lines?
So that's a great question. So bleach, depending on the municipal water system, you saw if we go roll back all the way to that pipe, remember all of that biofilm, bleach will not, I repeat, everybody needs to understand this. Bleach will do very good at planktonic bacteria. That's the free floating bacteria in your system. It is not very good at removing biofilm at all. Okay. So what's important when you look at that pipe, and I'm going to kind of give you a little bit of background on that. You always have your municipal water system's always going to be PSI wise, you probably 60 or 70 when it comes into your facility. So it's probably back closer to the municipal water system. It's probably up towards 100. One thing you always want to include in your water management plan is what are you going to do if you have a water main break? And the reason why that's important, think about all that bacteria that's in there. And then you have a water main break and the water comes, it just goes out. All that biofilm that was held in that position, what I call homeostasis, all from pressure. Then you lose all that pressure and then you turn that back on, it fluffs all that biofilm off. And then it goes, who's ever down that line, I know everybody's going to be mad at me for saying this, but everybody who's down that line just got a huge influx of bacteria into their system. That's why boil advisories exist. That's why in your water management plan says, hey, if you have a water main break, what are you going to do? So remember, chlorine, planktonic bacteria, it kills free floating. It does not work very well in biofilms at all.
We've got another one here. Would an at-home water testing kit be an acceptable way to do monthly testing of water?
I would need to understand more. What I mean by that is you can test your water for pH, you can test your water for chlorine. If you want to test your facility for validation of a water management plan, Legionella is the one that you want to test for. And there's the ISO 17131 culture test that you really would like to use. There's a couple other ones that are easier, but they're not defensible. So I don't know what that at-home water test would be testing, but if it doesn't test for Legionella and you're working on a water management plan, I would say no, don't waste your money.
Great. That's all we have so far in the Q&A. Um, Brian and I can hang out here for a few more minutes, and if we have any other questions that come in. If not, thank you so much, everyone, for attending today. Like I mentioned, we will send out an email with a link to the slides and a recording to this webinar. Okay, follow-up question for the at-home test strips. For regulatory purposes, a quantitative test would be required? Question mark.
Yes.
All right. Well, Brian, it looks like we've got people hopping off the call now. So, oh, one more. What's a safe chlorine level? I make water for the building. I think I run it at a 1.6.
That's a great question. So if you make water for the facility, it means you probably have a secondary disinfection system. The Safe Water Drinking Act says you cannot put more than 4 ppm is the max number of free available chlorine.
All right. I think that's it, Brian.
Okay.
Perfect. Thanks again, everyone, for joining. Like I said, we'll email out the slides and the recording to this as well. Thank you so much, everyone. Have a wonderful day.
Thanks, Rachel.
Thank you.